Madam Speaker, a number of my constituents from Colorado have asked me to share their stories about why we need health care reform. This story could be from someone anywhere. It could be from someone in Texas or California or New York. It happens to be someone from Westminster, Colorado. He asked that his name not be used, but he wanted me to share his story. His story relates to the diabetes that he suffers from. His insurance insists that he uses a generic brand of control medicines for his condition. But he participated in a study which found that he could reduce his high triglycerides by 75% if he used the primary drug for treatment. As a matter of fact, his readings improved so much on the study that he was removed as a candidate. He was advised by his doctor of the reading and the improvement, and the doctor decided that he had to go back on the generic drug and wait to see if his reading went back to the previous condition. This gentleman from Westminster feels that takes away his choice, just like the choice is taken away from tens of millions of American families, not only the families who don't have insurance, but even the families who do, who have no real choice in what insurance provider they use. Even after this gentleman from Westminster, Colorado, stated that cost from generic to primary is affordable, and he personally was willing to pay the small difference between the two, the insurance company still made the decision on what drug he could use and whether it was working. One of the flaws, the many flaws in our healthcare system today, is that consumers lack choices. Most Americans get their health care through an employer. Whatever the employer chooses, they get. If you're self-employed, an individual, many markets, the insurance industry is dominated 50%, 70%, in some markets 80% by one or two insurance providers. One of the critical aspects of healthcare reform that this body is undertaking is increasing insurance competition in the marketplace. Through the exchanges that are being created, we're creating a hyper-competitive environment where there can be dozens of insurance companies providing products and a public option. Because surely it's not fair to say to people as a mandate you have to have insurance, and by the way, here's some affordability credits to get it, and then throw them into bed with the sharks and say you have to get it from the insurance companies. It's great to have a public option there to help keep the insurance companies honest. By doing so, we give people like this gentleman from Westminster a real choice. If one insurer won't allow him to pay out of the pocket the difference between the drug that on the trial he was on, which could prolong his life and save his health, you know what? He can switch. Small companies that insure through the exchange, each of the employees of those companies will be able to choose for themselves any of the policies in the exchange. Yes, that's right. Today, small business chooses an insurer, and if they're able to afford it, because Lord knows it costs small businesses a lot of money, every employee of that small business has that plan. Under the proposed Democratic plan, each employee of that small business would be able to pick from any of the insurance options within the exchange, giving this gentleman from Westminster, Colorado, and tens of millions of Americans across our country choices in health care insurance that they simply don't have today. Thank you, Madam Speaker.